Today we are out and about with Rachel, a senior sister from the intermediate care team. She is carrying out initial assessments on patients who have just been referred to the team.
Hello, my name's Rachel. I'm a senior sister for intermediate care, and I'm coming out today to see patients for initial assessments. The first gentleman that I'm seeing is a gentleman that had a fall last night, and his daughter asked for us to come out and see him today. So I'll be going in there just to check that he's not acutely unwell, identify anything that we can do as a team to prevent him having further falls, and then we'll move forward and see whether we need any further visits from ICT or whether he can be referred on to another team such as Agewell. So as soon as we walk into the property, we're looking for any hazards, identifying if the property is suitable for the patient. You can pick up a lot within the first couple of minutes of being in a patient's house as to how they are and whether they might be managing at home. I actually phoned this patient's daughter prior to going into the property and got a bit of history from her as well, because she's the one that made the referral. There's a couple of things that I need to follow up on with his daughter in regards to his medications and how he manages those. Otherwise, for this gentleman, I actually think that he's got everything in place.
After leaving the patient, Rachel writes up her notes and hands back to the live handover team. She then travels to the next patient for another initial assessment.
So we've just arrived to see a lady that's been referred to us by her GP. She had some routine bloods yesterday, and the GP's concerned that something's quite high and wants us to do a repeat blood test. So we need to see this patient quite urgently because it could be that she's quite unwell. So my job will be to go in and assess her and see whether we need to send her into hospital or whether we need to keep her on the caseload. We'll get those bloods and then we'll get them sent off to the hospital and follow them up later today.
Rachel has an initial conversation with the patient to gather more information and medical details. She then carries out some medical checks, starting with the patient's temperature. Then she takes the patient's blood pressure. Finally, Rachel takes some blood from the patient. This will be sent to the hospital and processed later the same day.
So we've seen the patient today and she's quite stable, and we've taken some bloods as requested by the GP, and we're hoping to avoid the patient going into hospital by doing the blood tests in the community. So we'll follow those up urgently today, and then we'll make a plan from there. I will be wanting to see the patient again tomorrow, as her blood pressure was slightly elevated today, and moving forward she's not going to be taking one of her tablets, so we need to monitor her over the next few days, and then hopefully we can discharge the patient and keep her at home.
Rachel continues to see patients for initial assessments throughout her working day and takes appropriate action in each case to support the patient with onward care. For more details about the ICT team, including operational hours and contact details, please visit www.nhft.nhs.uk/ICT.